Every young person who's admitted to hospital will have a case manager assigned from the beginning of the admission, and we remain involved throughout until discharge. Our primary function is to have oversight of a young person's care, treatment and discharge planning, ensuring that it is safe, effective, of good quality and is provided in a timely manner with the least restriction possible. We aim to do this in a number of different ways. Firstly, we complete case manager reviews, which are usually held every 4 to 6 weeks on the ward and face to face. This is an opportunity for the young person to share their experiences of being in hospital and for us to receive feedback about this, both positive and negative, and we will follow up any actions or concerns that are addressed from that. As part of this review process, we also look at all the clinical documentation on the ward, ensuring that it is accurate, legally compliant, but most importantly that it's person-centred and individualised. Secondly, a significant portion of our role is working with the network around the young person. We liaise regularly with the clinical team through care planning and patient review meetings, so we can obtain updates, track progression and offer clinical challenge and advice where needed. We also link regularly with the community network around the young person, including community mental health teams, social care and education, to ensure that they remain involved throughout and that any potential barriers to discharge are identified and addressed early so that a young person doesn't have to be in hospital any longer than they need to be. Thirdly, we connect very closely to the quality team in the provider collaborative to share any concerns or issues that we become aware of, as well as sharing examples of good practice for wider learning across the inpatient network. The provider collaborative funds inpatient admissions for young people aged 13 to 18, and we have a wide range of presentations, so we can support people with eating disorders, emotional regulation or complex trauma, through to psychosis, as well as supporting people who've got neurodevelopmental difficulties in terms of autism or ADHD. In terms of supporting a young person through the case management role, it goes from the individual, so we will often act as an advocate for that young person, so offering that clinical challenge in terms of to the clinical team, what are we working towards, what's the aim of the admission, but also supporting the community teams to make sure that they are on board and that they're aware of what's going on and what their role needs to be. Ultimately, this helps to improve the outcomes for the young person so they get the most out of being in hospital, but then actually when they are ready to be discharged, the support is there and they can continue that progression without people staying in hospital too long, because we know that that ultimately reduces outcomes. When we get notified that a young person has been admitted to hospital, they will be assigned a case manager depending on which hospital or location that they're in. Our role is to have a look at the information that we have for that young person, what is the reason that they've come into hospital, what might be some of the presenting factors, but also what might be a barrier to discharge later on when they are progressing throughout their admission. So we will want to link with the clinical team so that they have a shared understanding of the reason for the admission, but also make sure that all the relevant community links are sort of shared with the inpatient team so that they can join the patient review meetings, just to bring the system together, ultimately for a shared goal of supporting that young person. Being a case manager is a job that I love. I have the privilege of meeting and supporting young people through a really difficult point in their lives, but also working alongside very dedicated and skilled staff teams who want to get the best outcomes for the young people in their care. I hope this has been helpful, and thank you for your time.